All right, welcome everybody to Health Bites. I am very excited for this presentation today. It's going to be a good one. We've never had this one before, so thank you so much for joining us. So my name's Alexa, and I'm a counselor with Your Medicine EAP, and this is our Health Bite series. It runs every month, and we have again a fascinating topic today. I already have my pen and paper ready to take notes. I'm serious about this topic. I find it absolutely fascinating and very helpful. So just some housekeeping things before we get going. If you have a question, please use the Q&A box so I can answer them live. If the question is pertaining to, what the presenter is talking about in real time, then I will ask them and bring voice to them. If it's something maybe just kind of a general question, maybe we can wait until the end if there's some time. So please feel free to use the Q&A box instead of the chat box. The chat box might even be disabled. So I think let's get started. I'm excited. So thank you so much for joining us today. It's a pleasure having you here. And the floor is yours. Thank you.
Thank you. I'm happy to be here. And please, if you guys have any questions, I'll do my best to answer them. Let's see. Is this going to advance? Maybe not. Let's try it this way. There we go. Okay. So today we're going to explain the impact of food allergy of quality of life and focus on resources that may be helpful. So I'm going to start with some definitions. We're going to talk about the pillars of food allergy management. We're going to talk about the classic IgE-mediated food allergy. So those are the ones with hives, squeeze, shortness of breath, the immediate quick symptoms. We're going to talk about food protein-induced enterocolitis syndrome, which is a delayed food allergy with predominantly GI symptoms. We're going to talk about adults with food allergy, screening, when to refer, and get through some resources. So just to set the stage, I wanted to talk about what we mean about quality of life. And so this is an individual's perception of their position in life in the context of the culture and value systems in which they live, and in relation to their goals, expectations, standards, and concerns. So quality of life can be perceived very different depending on where you live in the world. So it's important when you think about quality of life and you think about food allergy disease burden. And so the things that I often hear from patients and families is that, a lot of things in life revolve around food, and that is tricky. And that social events involves food, and that after soccer practice, there might be the team snack, and that parents worry about their kids getting exposed when they're playing with other young children, especially when they're in that age that they may mouth the toys. And so this can cause a lot of stress. But there are ways to navigate these things successfully. So health-related quality of life is really an assessment of how the individual's well-being may be affected over time by a disease, disability, or disorder. So you can see how this is different than just quality of life in general. Another area where there's often confusion is worry and anxiety, and these are different. So worry is cognitive in nature, so the thoughts that are in your head, where anxiety is more physiological and the thoughts can be less focused. So anxiety, you may feel more in your body, so that racing heart rate and that tension, or some of those things that you feel maybe after you've run a race, sometimes it feels the same way. So then when we think about food allergy management, we think about prevention and we think about being prepared for emergencies. And the hardest part about this is that it must be applied at all times and in all settings. And so things that we need to remember is to do allergen avoidance. We do that by reading labels. We need to communicate about our allergies to the people that are maybe preparing our food or serving our food. We need to educate others. On the emergency preparedness side, We need to have an anaphylaxis action plan, recognize anaphylaxis if that happens, and carry and use our self-injectable epinephrine. And now we actually have a nasal epinephrine as well. And so, of course, if we treat and our symptoms haven't completely resolved, we have to activate EMS as well. So the common psychosocial concerns in food allergy management include the impact of dietary restrictions and social limitations on quality of life. The adherence to management routines and plans can sometimes be frustrating, and anxiety about potential exposures. And one of the things that is most unsettling to people is living with this uncertainty and risk, and then dealing with differences and the potential for food allergy related bullying, and coping with medical procedures and treatments. While sometimes people are grateful that we can do them, they may cause stress acutely. And then another thing that often is a concern for families is, how do I transition the responsibilities to others? And how do I get myself comfortable with that? And whether that's leaving your child in the care of others or the school staff, or as you're transitioning more of the responsibility to your teens. So IgE-mediated allergy is the most common of what we're going to be talking about today. And the classic thing that you probably hear the most about with respect to this is peanut allergy. So someone is exposed to peanut, they have immediate hives or rash, they may have cough, vomiting, shortness of breath. And so these are pretty quick reactions. Most of the time they occur within 15 minutes, although we accept up to 2 hours. And it's been shown that there's definitely impaired psychosocial functioning in children and caregivers if you look at the group as a whole. And 35 to 45% of children with food allergies experience bullying. And the data has shown that children with food allergies are about twice as likely to be bullied compared to children without. And the hardest part about this is parents and their physicians are often unaware that this is occurring. So I make it a point to ask about this at all visits. And I think parents, oftentimes kids don't want to report it. And so that's how parents are in the dark. And so aside from the things that we spoke about, there's a number of factors that impact food allergy quality of life. And some of those things are what the actual food is. It's interesting because peanut is often the food that many families worry about the most. And I have some kids that are teens that perhaps they've outgrown. We can do a food challenge. And they may say to me, you know what? It's easy to avoid. I don't really care. I'm fine with avoidance. But for other foods like milk and wheat, families are usually pretty motivated to do challenges and to see if that has outgrown because it's harder to avoid. And there are confounding factors like age, the severity of the reactions, if someone has had a history of anaphylaxis and how long ago that was, and how many food allergies does someone have, and are they doing treatment? So oral immunotherapy is a treatment where you give people small amounts of their allergen in hopes of raising their threshold for reacting. And that has shown to improve quality of life. Other things that have been helpful or hurtful with food allergy quality of life. Sorry, I'm trying to move this out of my way so I can see the whole slide. In this study, they found that the age, the number of reactions, and the number of foods avoided, milk, egg, and soy avoidance, and epinephrine use within 4 years, and having to do strict avoidance and reactions to trace exposures of a food were associated with worse quality of life. And you can see this on the left here. The bottom left, you see worst food allergy quality of life on the y-axis, and then you see in green the number of reactions, the age, and the number of foods avoided. And so oftentimes teens don't like being different. And remember, this is a time where focus goes external. And so we sometimes talk about that special to different transition where kids are younger and they have their special cupcakes or their special this and that. But then as they get older, they see that as being different, and that's not something they typically like. So this study looked at the impact of oral immunotherapy on food allergy quality of life. And this was done in 8 to 12-year-olds. And so this is the food allergy quality of life child form on the y-axis. And then you have different time points during people were doing immunotherapy. So you see at the start, the end of updosing and follow-up. And what you see is as these numbers go down, food allergy quality of life goes up. And so even though oral immunotherapy is not often a cure, it may raise the threshold for having accidental exposures, and that in itself often improves quality of life. So there's a non-IgE mediated food allergy called food protein-induced enterocolitis syndrome that presents with delayed GI symptoms, often recurrent vomiting, and you may have severe abdominal pain and diarrhea. In the young kids in particular, this is associated with lethargy and pallor, and the kids can look kind of floppy. It's pretty scary to see. And in a study that we did, we found that children that have persistent FPIES might have increased anxiety. And the caregivers also have impaired psychosocial functioning. And when we compared quality of life in caregivers of children with FPIES to those with IgE-mediated food allergy, we found worse quality of life in the caregivers of children of FPIES. And factors associated with impairment were the number of foods avoided. So the more foods avoided, the worse people did. The lack of awareness. There's far greater awareness of IgE-mediated allergy than non-IgE-mediated allergy. Some people had a misdiagnosis or a delayed diagnosis, which caused a lot of stress. And the challenge with FPIES is that we don't have a test to say what food someone's going to react to or when they've outgrown. And this can cause a lot of stress because we just have to try it periodically. And as you can imagine, if something is going to make you violently ill, most people aren't really excited to do this. So what we did was we looked at the food allergy quality of life parental burden. This was 295 caregivers of children with FPIES. And what you see is it's scored from 0 to 6. And as the numbers go higher, so 6 means extremely troubled. So as you go higher, there's worse quality of life. And so this red line shows moderate limitation. And as you can see, for the areas of vacation plans, restaurant choice, social activities, meal prep, anxiety, appreciation for severity. This other caregiver is the idea of how you feel when someone else is taking care of your child, and then the child's burden. So this really has a significant negative impact. And then what we did was we looked at quality of life, and then we looked at, so this is quality of life, this FACL PB. This PSS-10 looks at stress. The PSWQ looks at worry. And this is the Beck anxiety inventory. And then this looks at self-efficacy. And what you see here is that as self-efficacy goes up, parental burden goes down. So that tells me that we have to do everything we can to help with self-efficacy to improve quality of life. So to summarize some of the psychosocial impact of FPIES, we know that the way the parents are feeling impacts the child and vice versa. And so when the things that impact caregiver mental health, we may see increased anxiety associated with decreased food allergy self-efficacy and decreased quality of life, and then increased stress and worry. When in the child, we may see increased anxiety as well. The other factors that we need to think about is there's a large financial burden with food allergy. So the cost of hypoallergenic formulas, perhaps lost job opportunities. In our study, many parents did not send their children to daycare because they were worried about people keeping them safe. And then, of course, the out-of-pocket medical expenses. And this lack of sending your child to school or childcare because of your food allergies was reported in a large proportion of our population. Another factor that can have a huge impact on quality of life is food insecurity. And what you see here is the odd ratio and confidence interval showing the effect of different subgroups on food allergy, on food insecurity rates when they adjust for other factors. So when people have milk and egg allergy, we see larger issues with food insecurity. Keep in mind that all of these foods are more expensive. And then another area is we found worse or more food insecurity in our African American population versus our Caucasian population. And we've also found our patients with asthma may have more food insecurity as well. And so what I've included here are some food pantry links locally. I can say while we do have some food pantries available, I don't feel like we have a great infrastructure to help with allergen-friendly food, but that's something that we're trying to work on. So some questions that often come up when we think about psychosocial issues in food allergy is in early childhood, families want to know, how do I teach my child about food allergy in a developmentally appropriate way? How do I get other caregivers to take my child's food allergy seriously? And how do I help my child participate in activities outside the home and keep them safe? And then as kids get older, you're trying to teach your kids about food allergy. They're spending more time on their own, but at the same time, you don't want to cause undue anxiety. And then how do you help your child deal with peer situations and help them feel good about themselves? And then as you move to adolescence, this tends to cause a fair amount of anxiety for families. Because is your adolescent going to do what they're supposed to? Are they going to report their allergy? Are they carrying their epinephrine with them? Are they going to use it if they need it? Then what about food allergy in adults? So it's now thought that IgE-mediated food allergy affects about 11% of adults in the United States. And this is becoming an emerging public health concern. Half the adults in the study have reported having a severe reaction, and nearly 1 in 10 adults reported going to the emergency department in the past year for food allergy related reactions. And so this study wanted to look at healthcare utilization, comorbidities, and quality of life. And interestingly, the adults with adult onset food allergy report the least severe reaction symptoms, the lowest healthcare utilization, and have the lowest level of reported burden. Where interestingly, the adults that have both childhood and adult onset food allergy report the highest level of burden. And they also report the highest level of more severe reactions and multiple food reactions. And I imagine it's particularly difficult when you were dealing with a few food allergies as a child and then you developed some more as an adult. So ultimately, the goal in food allergy management is this idea of promoting balanced coping. And so, in other words, we want to have sufficient levels of vigilance to manage the food allergies and take them seriously, but without having excessive anxiety or avoidance of social activities. And so, this is a delicate balance. So, as a physician, what can I do to help? And so, one of those things is to offer food challenges when it seems appropriate. The literature says that whether it's a successful food challenge, meaning that the child or the adult had no reaction to the food, or if it was a reactive food challenge where they did react to the food, most people for both groups, quality of life has improved. Because one, if you can remove a food allergy from the list, that of course can be helpful. But on the other hand, even those that react report a positive benefit because they know they're avoiding something for a reason. And the other thing that's important as a physician, we need to recognize that this diagnosis can feel overwhelming. It can lead to anxiety and it can make parents, caregivers, and patients feel scared. And sometimes the clinical focus of a visit may leave people feeling unprepared for the practical aspects of managing food allergy. And so it's really important that we provide both education and support simultaneously. So this next series of slides, I'm going to run through pretty quickly. I just wanted to make you aware of some resources, and we could also send these out. But depending on the age of the individual, there's a bunch of children's books that can be useful to help talk about food allergies. There's some TV shows have done this. And then there's some music, and then there's some coping toys as well. And then there's also books and magazines that have been helpful. And some of these are more geared towards adults, but others are more, the books on the previous page are more geared for the younger kids. And then I'm going to show you some handouts that we put together for parents. And then there's a bunch of apps that some people find very helpful. There's also websites that can be useful. I do caution people, and these are pretty reputable groups that I've listed here. I do caution people, though, that if you're going somewhere and you're looking at stuff and it's causing a strong emotional reaction, you might want to stop reading it because there are some sites that are more inflammatory than beneficial. And then here's some resources for food insecurity as well. Now, I don't know the role of everyone that's on this talk, but I just wanted to mention when I think about referring to a mental health provider. So if the family would benefit from additional psychoeducation about food allergy, if the parent is difficulty asserting their food allergy needs with other caregivers, if the family needs assistance with food allergy related management concerns at home or school, and it's, going beyond what their physician can help them with. And then sometimes it can be helpful to meet with someone if they've recently had an allergic reaction and they're feeling more worried. And it's also if the child is having a hard time asserting their needs outside the home, sometimes practicing these things with kids can be helpful. Any difficulty coping with a food allergy or significant anxiety. Anytime people need maybe a little extra preparation when preparing for an oral food challenge or maybe a clinical trial or maybe oral immunotherapy. And another time, sometimes a family will need assistance when you're at those transition times. Those often end up being the times of greatest concern. And while I'm thinking of it, if you have a child with food allergy and they're about to start school, I often tell families to check in with the school at least 6 months in advance. Schools have gotten far better at managing food allergies since I started in practice, but my experience has been it can be really hard if something they're telling you doesn't feel right to you. And this works best when you can have a civil conversation. And so if things don't feel right, if you start early, you can end the conversation, you can get more information and have time to understand. So you don't feel like the week before school, things aren't arranged the way you'd want, but now you're kind of stuck. There are resources. We have a number of local individuals, but there's also this food allergy counselor directory includes many licensed psychologists and some social workers that have experience with food allergy. And many of them are licensed in more than one state. But if you can't find someone with an expertise or interest in food allergy, anyone with experience with child anxiety or chronic illness can be helpful. And I know if my patient sees someone local and the psychologist has questions, I'm always happy to talk to them. And skip that. And so I mentioned this earlier, this whole idea about self-efficacy. So self-efficacy is the belief that you can handle your child's food allergy or even your own. And so what they looked at here was activity limitation on the y-axis, low, mean, or high worry on the x-axis, and then they looked at self-efficacy. And what you see here is those with low self-efficacy in these little squares, the black line with the squares, have the highest amount of worry and the greatest activity limitation, where those with high self-efficacy have lower, have less activity limitation, even if they have some worry. So that brings me to some handouts we put together on managing food allergy. And so we wanted to create a developmental approach because as kids age, there's different safety issues, there's different psychosocial issues, and there's different roles. And by gradually improving upon skills and knowledge, we can increase safety, decrease anxiety, and improve confidence. So a bunch of us put together these handouts, and our aims were to provide reliable evidence-based information focused on balanced coping and provide practical tips for integrating food allergy management into daily life. And in essence, provide a roadmap for involving children in their food allergy management over time, and make this easily accessible online and free to meet the varied health literacy needs. So what we did was we put these in age groups. We modeled them after the EAP's ages and stages. And the topics we use are listed in the top left. And you see the groupings we did on the top right. So I'm going to give you some examples. So the first, this is including 3 different groups here, the baby group, the toddler group, and the preschool group. And so we call this group the active and curious. And so as you know, the young kids get into everything and they watch what you're doing though. And so you're their role models, and daily routines provide a sense of security. And so we want to use simple safety-focused language about food allergy. And at this stage, remember, parents are primarily responsible. So parents may feel overwhelmed and they're really worried that kids are going to get into something. And so we don't want people to limit activities. We want to give you the tools to go out and do the things you want to do. So when teaching children about food allergies, it's important to use a calm tone, simple terms, and focus on safety. So something as simple as you're allergic to eggs, Eggs can make you sick. You point out before you go out, we have our medicine bag, so now we can go to the park. It can be useful to explain routines out loud so that why children understand why they're important. And so you can say, well, we read the label, so now we know there are no eggs in these cookies. They are safe for you to eat. And when kids see that you do these routinely, ultimately, they will do the same thing. So teach your child not to share food. And so you can role play with parents, with your children rather. And so you can encourage them if someone offers them a food that they can't have. You can say, no, thank you, I have allergies. And then you can support their self-esteem by helping them label their feelings and giving them simple choices to increase their sense of control, and also praise them for following routines. So daddy brought you snacks to the park. Would you like the crackers or the fruit? Or saying to them, great job washing your hands before you eat. As kids get older, and I skipped a bunch of them here, I just wanted to show you the youngest kids and the older kids. But you'll have a link to the handout so you can look at all of them. So the young adults, we want them to take primary responsibility for the day-to-day management. But as we're encouraging them to do this, it's important to provide continued support, remind them that they are not alone. And especially when kids are going off to college, it can be helpful to remind them that family, friends, and roommates can be a great support, and that over time they will feel more confident. So some of the challenges with the older kids is that they really need to get involved in their healthcare. I encourage teens to become involved, maybe around 13, 14, 50. It depends on the child, but the more we can get them involved, the better they're going to be when they leave home. And as a parent, the better you're going to feel. So you can ask them to prepare for their appointment with their allergist. Do you have any questions? Write them down. Maybe getting them to attend appointments alone, or maybe you just go there for moral support and you don't say anything. It's also can be important for teens to have one-on-one time. Sometimes there's questions they're not comfortable asking in front of their parents. And then, think about strategies to remember to refill prescriptions. So some people, when they get their self-injectable epinephrine, they will put the date that they expire and maybe set a reminder a month before to get a new refill. And if they're going to school, it can be helpful to know where the nearest hospital or medical facility is. And so I often encourage families to know your options at college. Usually you work through the Disability Services Office, and it's important to know how food is prepared in dining halls, how students access allergen information, what special meal options might be available. Is there an emergency plan in the dining facilities? You might want to know about housing and roommate options. So do you have multiple allergies where you feel you have to cook for yourself? Are you comfortable having a roommate? Would you be comfortable if your roommate has the food you're allergic to in the room? Would you prefer to have a roommate that maybe also has a food allergy? So it's important to think about these things in advance. And if you're in a dorm, talking to the resident advisor and understanding what they know about food allergies or not, and then speaking with your roommate about how to keep a safe space and what to do in an emergency can also be helpful. So the reason we think the age-based handouts are important is we think they improve quality of life, improve comfort, safety, and of course, improve self-efficacy. So ongoing education is important. At different points in time, there are different challenges. As kids get older, they notice more differences between themselves and others. As they get more independence, things change. And then, new situations pop up. So dating, kids as they get older spend less time with parental supervision. But we also look at these as a roadmap to independent care. So how to use the handouts? We encourage physicians to use them during visits. They can be used online by families. Families can use them to educate others. And this QR code here will take you to the whole series of the food allergy stages handouts. You can also type this link essentially into your computer, but you can also type food allergy stages and quad AI. So just do 4 A's and an I, and they come up. And the neat thing is we have them available in both English and Spanish. So to conclude, food allergies have a significant impact on quality of life. As caregivers and as providers, it's important that we listen attentively to understand what's being said, but also what's not being said, that we provide continued support, we utilize evidence-based resources, and make sure that if patients and families are struggling, we refer them to a mental health practitioner. This is a QR code for a study that we're doing, looking at college students that have food allergy. We're trying to understand the experience of college students, but we're also trying to understand what factors prior to them going to college promote successful food allergy management. And so if you know anyone that's a college student, please share this with them. And on that note, thank you for listening. I'd be happy to take any questions.
Thank you so much. And I appreciate you shedding light on this and just not only the anxiety potentially for the individual, whether it's, the child or the adolescent or the adult with the allergy, but also the caregivers. My daughter, we thought she had a milk protein allergy, and it is very stressful just going through that process and the formula. And then if formula isn't covered by insurance, right? So there's a whole lot of that anxiety on the caregiver of watching, your child go through this, wanting to provide them with the nutrition they need, having all of these negative side effects. Is there an allergy? Is there not an allergy? Right. And then, so I thank you for shedding light on that, because it's stressful.
It's hard. I mean, no one wants to see anything be less than perfect with their child. And then when you end up, and there's a lot of emotion tied to food too.
Yep.
Right. And so all of that, and I can't tell you how often parents say to me, did I do this? Did I cause this? And of course they did it, right? There's a lot of factors that come together that do this, but I think as parents, sometimes we internalize all of that.
Absolutely. We're great at that. Yes. Yes. But I appreciate you touching on not only, the individual, but also, the caregivers or, the team, and kind of providing, some resources for them as well, which is awesome. Does anybody have any questions?
Maybe I put everyone to sleep.
I'm not, oh my gosh, no. I'm not seeing any. And those handouts that you mentioned, how do we access those?
So you'd either do the QR code if you took it, or if you type food allergy stages into Google, I don't even know if you need the quad AI, so it's 4 A's and an I. It will take you directly to them. They're free. They're not behind the quad AI firewall.
Cool.
And so you can access them there. You can see, and you can get them in both English and Spanish there.
Awesome. I'll definitely be checking that out.
The other thing I guess that I might just say is
Sure.
that, if someone's not sure if they have an allergy or not, it could be worth seeing someone to figure that out, because a lot of the studies show that far more people think they have a dangerous allergy than they do. And sometimes just knowing that this isn't going to be life-threatening can provide a fair amount of relief as well.
That's a great point. of almost kind of like walking on eggshells around food, right? And you brought up a really good point of then shifting your relationship with food. And yeah, I've worked with individuals in the past who were diagnosed with eating disorders. And sometimes it started with that. Oh, I'm allergic to this. So I'm not going to eat
Yes.
this. And then I'm not going to eat this category of food. And it just kind of escalated.
Yeah, and in my world is that sometimes when someone has a problem with one thing, what ends up happening is they become very aware of these feelings, and then sometimes things get over interpreted, and it's understandable, right? But I don't want people to avoid more than they need to. One, because it's socially hard, but two, it can lead to nutritional issues and other problems too. And
Yes.
so I find addressing those things early and getting support early
Mhm.
can make a huge difference.
And it seems like, and obviously you are the expert on this and I'm not, but it seems like there are way more alternatives in a sense of like food or, things that can still provide people nutritionally, even if they do have allergies.
And yes, it's amazing. I mean, we're pretty lucky where we live. We have a lot of options, and now even online, people can get stuff shipped to them. But there's areas of the country where people live in food deserts, and getting nutritional food in the first place, never mind getting these alternatives. And that makes things really, really challenging. And then if you add in the food insecurity
Mhm.
piece, there's higher rates of food insecurity in those that have food allergies, partly because the allergen-free foods are more expensive.
Mhm.
And so screening for that becomes all the more important as well.
Absolutely. Yes, this is sort of related, I guess, but we at EAP celebrate everyone's birthday, and an individual counselor has certain food allergies, and I was the one who was designated to buy the snack for, the team. And I didn't realize there was an entire, aisle filled. I mean, Wegmans is just amazing, right? But
Yes,
filled with
very much.
all of these, different kinds of food and things to support her allergy, which I thought was wonderful. But you're right, it definitely, can hit the bank a little bit, right? I said, okay, she's obviously worth it. But
Yeah,
you're right. I mean, it's just kind of one more thing to think about, as a parent or as a caregiver or as just an individual, as a college student,
yeah.
right? I mean, I didn't have a lot of money when I was in college, right? I probably wasn't able to even walk down that aisle, right? At Wegmans. Yeah.
Yeah, the other thing I should mention is, and it's not directly related to this topic, but it might be useful to anyone that has IgE mediated allergies. There's now a nasal epinephrine available. It's called Neffy. And so for people that it's needle free. And so I just mention it because for people
Interesting.
that are fearful about having to use self-injectable epinephrine, this is a needle-free device. And so the hope is people that should have used their epinephrine in the past that haven't because of the needle, that this
Mm,
might be a nice alternative and reduce the stress somewhat of having an allergic reaction. And so I just wanted to let people know it was out there in case it's for people 60 pounds and above.
that's
So
incredible.
just in case that helps anyone.
Absolutely. I mean, it's a way to eliminate a barrier, right? To kind
Mhm.
of receiving that support.
Yes.
Thank you so much for joining us. This was
Oh,
lovely. And it was a
thanks for
pleasure
having me.
to spend time with you and everybody who joined. So we are recording this and this will be up on our EAP Health Bites website. So if anyone wants to click back, I know I definitely will, to be able to see some of those resources in those slides that you mentioned. And again, thank you. This was wonderful. We appreciate your time and your busy schedule and allowing us to hang out with you for a little bit.
Well, thanks for having me, and I hope you guys have a great holiday season.
Thank you. You too.
Thanks.
All
Take
right.
care.
Bye, everyone.
Bye-bye.